Welcome to The Patient Physician, a space for doctors to explore their physical, mental, and financial wellness. Your peers and industry leaders will destigmatize institutional perceptions while redefining success, money, and personal care. Get ready to pull back the curtain, because here, you are both patient and physician.
So my name is Karen Avgash. I'm an internal medicine program director at Mount Carmel, and it's based in Columbus, Ohio. How do you find or create meaning in medicine? I guess it's more something personal. For me, I find meaning in medicine when I see my patients healthy, happy, successful in the future with their health and thinking about it forward. But not only that, being part of a teaching program, I think I find more so meaning in helping to educate the future generation. And when I see them interacting with the patients the same way I do, with compassion, with care. Sometimes, medicine, we look at all the numbers and we read all the books, but it's really important to connect with the patients, to sometimes be the shoulder that they cry on, to help them more with the day-to-day. And then also understanding the social determinants of health. How do they get to the appointment? Are they feeling okay? Do they have a good social support system? And really connecting with them as a person, and then helping them throughout their journey in life, and being able to impact them and their futures, to then hopefully go out there and to create physicians that care really about the well-being within their community. And not only that, but an outreach within the community. One of the examples is recently we're becoming more involved with something called Walk with the Doc in our program. And so what that means is that 2 times out of the week, we actually go out and we have walks where we talk about a topic in medicine with the community that come out. And now we get to walk with them, exercise, talk about diet and changes or hypertension, whatever topic we feel like. And they ask us questions, and we get to now outreach with them, really take a walk with them. Any questions, be out there within the community. And I think that's what it's all about, and really coming back to the roots of medicine. And so that's where I find meaning in medicine.
That's so great. It sounds like with the Walk with the Dog, was this your idea?
Part of it. It is a organization that is around where I'm at, and now we're actually growing it to be specifically around our hospital and our community.
I love this idea because you're not only getting to visit with the patients in the community and get to know more about them, but they're getting to see you in a more human element.
That's right.
And I think that the challenge for physicians and for people in the medical community is that they get put on a pedestal, and oftentimes there's a separation. So you being able to do that connects you back in with them as on a very human level. How long has this program been going?
So it's been around the area for a while, but this is going to be newly started around our area. It's called Grove City around Columbus. So it's going to be starting up in May. We have a lot of residents who are interested in our volunteering. I'm also excited as well, some of the faculty member, and going and joining in. And so I think very importantly, outreaching. We also have a lovely resident garden at our hospital where the residents can grow the food. And so if patients that are struggling with, essentially food insecurities, now we get to have a garden, pick the foods, and hand it to our patient. Part of, again, connecting with our community and understanding the importance of it.
Wow.
That is fantastic. I immediately thought, Paul, I agree from a doctor's aspect, but how many times are we meeting with the doctor, the physician? They're busy. We have that little question, but we just don't have that amount of time to ask. So we end up going online, we end up asking a friend, we ask somebody who's not qualified, and a walk is a perfect opportunity. You lower the threshold, give people an opportunity to say, hey, and you never know, it's kind of like asking that question in class, the likelihood is someone else in that group is going to benefit from that doctor taking the time to share, hey, here's a true perspective on what that is, right? Or maybe you need to come in and see us. How do y'all get the community involved?
So we work with an organization who does the advertising and marketing. It's already in different suburbs around Columbus area, and now we're going to be starting it around our suburb.
Okay.
And so they're doing all the marketing, but it seems like it's a good turnout in other areas, so I'm excited to see what the turnout's going to be around our community.
Yeah, and the food, producing healthy food for people. What a well-rounded opportunity. I think that's great.
I think it's important to produce well-rounded physicians that, not only know the medicine and being book smart and understanding, but understanding how are we getting these medicines to these patients? What is the cost behind it? How are they getting to the clinic? What is their social support? Are they exercising? Why don't they come and walk with us twice a week? And I think it's about understanding a patient as a whole and not, having a narrow view of them. So I'm excited. I love our residents. Our residency program is phenomenal, and the creation of really these well-rounded individuals. Mm-hmm.
That's fantastic. How long have you been in the academic space and educating?
Wow. Ooh. It's been quite a few years now.
It can't be that long. You look too young for you to do that.
Almost 10. Yeah. Always learning from other programs, learning from other places, creating your own, and really having an interesting outlook. We have a very unique part of our program is culinary medicine, where we actually cook with our residents.
Wow.
We have a nutritionist coming in, and we do different, for example, hypertension. What does the diet mean? How many times have you guys heard from a doctor, hey, diet, exercise, what does that mean? So our residents can be like, oh, low salt diet. Let me tell you what the recipes that I've used, that I've cooked, that I've made quickly, and truly understand what low salt means. When tasting it themselves and saying, oh, okay, definitely wouldn't try that way. This is what I found that works really well. And so when they talk to the patients and really outreach, they can tell them how much things truly cost in order to make it, how they cook it, what they've tasted, and that really works well, and really being able to practice that type of medicine and truly understanding that how many times do we give medicine, but how many times do we really talk about the diet component, the exercise? Let's go on a walk. Let me tell you what diet that I've worked on. So we have this culinary medicine a few times a year. Actually, when I get back next week, we're having a cooking class. But yeah, so this way, a few days leading up to it, we talk about recipes.
I love to cook too.
Love to cook.
Did you get that one? You should have that one.
I should have that one. This is my first time here at ACGME conference in Nashville, Tennessee. Today we did a program session for program directors all day. And during the sessions, I really got to talk about different aspects of the program, more so fundamentals, about review process, milestones. And I think the important message that I take away is, yes, everybody has ways to improve, but trying to really focus on how can we implement ways to help our residents improve, kind of pinpoint the concerns that we have, and then implement a plan, and what can we utilize for that plan moving forward in order to help them grow. Part of what I'm doing right now is going around all these different booths and learning about different ways that I can help the residents improve in that plan. So question banks, case modules, different lecturers that can come to our program and help teach. And so I think it's important to have very different views and different ways that you can help assist each learner, because everybody learns differently.
Usually when I do a conference like this, there's a lot of great things that you can take. What's one that stood out for you?
There's a lot of program directors today that had a lot of years of experience. And what I take away is that there's always room to grow. There's always room to learn. Be humble. And ask when you don't know something, and don't be afraid to do so. And so I'm appreciative. I'm very grateful to my program that I get to be here and get to be here learning and being involved. And, I have so many notes and pamphlets that I now get to go home and review and see what's best for the residents in the program.
That's awesome.
Yeah.
Well, as you build out the culinary curriculum, he makes a mean sourdough bread.
Oh.
So you may just want to bring him in.
Okay.
Yeah. Thank you for being here. Thank you.
No problem. Thank you. I appreciate you having me.
Yeah.
I am Jody Godfrey, Deputy Director at the American Medical Women's Association. We are an organization whose mission is to advance the leadership and the careers of women physicians and trainees, and to improve the health for all women. We are here at ACGME to share 2 certificate leadership programs. One is a certificate leadership for women physicians, for faculty. It's a 9-month virtual program. It focuses on all of the key competencies that we know are necessary to boost your leadership skills, your strengths, your focus, find your leadership style. And we also have a certificate in leadership for women in training for both residents and fellows. And that's an 8-month virtual program also. And it's across all disciplines, across geography. And the beautiful thing about that is we focus on skills so that we can reduce the sense of imposter syndrome that tends to creep in for most women, and to reduce the risk of burnout, which all women physicians are facing. And this leadership program addresses all of those aspects in this virtual program that's really geared toward the schedules and the limits of trainees, and still allows you to come out with the competencies to build your skills and your insights for your career forward. So there's many more benefits of joining the American Medical Women's Association and becoming part of our community and joining the advocacy. We have other resources, including fertility for physicians, medical humanities, so many other things that we'd love you to check us out. And you can do that at AMWA, AMWA-doc.org.
My name is Sandy Molina, and I live in Columbia, South Carolina. I work for Prisma Health. I'm the Fellowship Administrator for Infectious Disease and Endocrinology. I've been in graduate medical education for about 30 years now.
30?
Yeah, that's a long time. What changes have I seen? I think mainly entitlement. I mean, our fellows now are just... they're not as motivated to work more, I guess. I don't know what it is. I feel like I'm having to hold a lot of people, hold everybody's hand.
What do you think has caused that?
I've noticed mainly the change was after COVID. No one really wants to come in and work and do things. And that's the drastic changes I've noticed in all the years I'm doing it.
How are you having to combat that now? What are you doing to try to change that? Because they obviously, to be good at what they do and they need to graduate. How are you helping in your role?
We're doing a lot more well-being, wellness events for them. I am a lot older than a lot of my fellows and residents, so I feel like I'm everybody's mom. So I have like little sessions in my office to kind of figure out what's going on and just try to motivate them more and be their cheerleader.
So if you're having sessions, that means that it sounds like you're having good conversations or conversations that might be deeper than the role really calls for. So what's a few of the consistent themes that you're hearing? What are the concerns? Because that's probably what you're hearing, the struggles, the concerns.
Yeah, I'm hearing,
what are you hearing?
I'm tired and there's a lot of work to do and I need some time off. But also in fellowship, a lot of them already have families. So they have to juggle work life and I have one fellow that is having their second baby and they're just very exhausted and just offering babysitting services. Mm-hmm. What can we do to make things easier for you? So you can come back to work refreshed. Try to give them a day off during the week and reduce some of their patient load a little bit.
How are you supporting them in those conversations? What do you share or say to help encourage them along?
I mainly just listen. I just listen and just let them vent. A lot of them don't really want you to give them a solution. I think they just want someone to listen.
I think that's probably very true for a lot of situations.
Yeah.
Yeah. Bernice Murphy.
Yes.
Where are you from?
I'm from East Carolina University, the Brody School of Medicine.
Bernice, describe the future of medicine from your perspective.
The future of medicine now, especially with the AI generation coming in, is going to be better than ever. With the way we do our training now, it's going to be more robotic. Especially in my field, because we do a lot of thoracic robotic surgeries along with the cardiac robotic surgeries. But the future of medicine is going to be beyond anything people can dream of now.
Do you see that any of the physicians are worried about this evolution, or are they excited about it?
Excited. I see them as very excited. They're getting more enthused every day because there's so much research. And in the surgery department, they're doing more research now than ever. So I think they're very excited. They're not worried at all.
how long have you been in the GME program and supporting residents?
In the GME, I've been 9 years now.
9.
Yes.
And you say in the GME, what did you do before?
I was an educator in public schools. I was
Okay.
a teacher and then a principal for 21 years.
Wow.
Yes.
Okay, so you know how to handle and teach these people because that's what they need.
Exactly. We can kind of predict the future of some of the trainees just by seeing how well they work and how they're working towards it and what they're working towards it, and kind of guide them in the right direction of what we think they should do if they have questions. Most of them come in already knowing basically what they want to do, but sometimes they come into the field and they see it's a different type of medicine they may want to change and go into. So we can kind of tell that.
So you've been in some form of education, sounds like, all your life.
32 years.
You used to be a principal.
Yes.
What high school, middle school, elementary?
school.
Middle school. Okay,
Yes.
so those are just a bunch of deviants running around.
Yes.
So is there any similarities to how you have to work with the residents and fellows at this level that you learned from, working with middle school?
Yes, it is, because even though they are more so adults now in the medicine and they kind of know what they want, their well-being is just as important as the ones in the middle school. And I also did elementary school. And we, as the coordinators, have to also make sure our trainees are being taken care of. It's so much goes into the clinical and the educational piece that people don't think of how much they need some additional help with their well-being. The suicidal rate in medicine has gone up, and it's because some people just think, okay, we got to do this, we got to get this done, we got to take care of the patients, because patients are number one. But how are we going to take care of the patients if we're not taking care of the trainees?
Right. I know patients are often viewed as number one, and we say that, but aren't our physicians number one, just like the airplane mentality, right?
Yes.
Shouldn't we put our own mask on first and then take care of the person next to us to be the best we can be?
There you go. Exactly.
So there is a lot of concern and emphasis around wellness. I agree with you more than you know about them needing to take care of themselves. And I think there's probably more of a parallel of kids in middle school not really taking care of themselves and knowing how. And the same thing with physicians not really having the time, though.
Right.
They're learning so much and taking care of everybody else that they forget to take care of themselves.
Exactly.
So how do you help with that?
Let me give you an example. Flu season is in effect now. Our physicians, you see them sniffing. You see them looking like they're coming down with something. Their eyes may be a little red and may look a little pale, but they keep pushing themselves. And they keep saying, no, I got this. No, I've got this, while they're going downhill. It is our job to make sure that we pick up on that. But not only our job, we teach the trainees and the faculties and everyone to kind of be aware of what's going on around you. And if you see something that maybe they're in denial about, help them out. Pull them to the side, take over, take call for them, send them home, let them take care of themselves. Have them to go see a doctor to make sure they are okay. And most of the time, it turns out they may have the flu or something like that. So that's when we go, don't worry about it. We'll cover. We'll find someone that will take your place tonight. We'll find someone, but we're on call. They say we're on call or we got to do this. Way. No, you're not going to be on call if you don't take care of yourself and you're not here. So that's where we step in.
What's the most rewarding part of your job?
Making a difference in the trainee's life. I feel like I make a big difference in their life. They often come to me in confidentiality situation that they just want to sit down and talk about something that you can't really talk about in the OR. You can't really talk about in the lounge, but they need to be heard and they want a solution to the problem, but they don't really want to go to a faculty, so to speak. So they still need someone that can intervene, help them out, get the job done, but yet not be told it was them. So, and I come in and I kind of look around the holes and help them out and whatnot. And it's very rewarding because they'll come back 2 or 3 weeks later thanking you. I said, I don't know what you said or done, but things are much better. So,
Well, it sounds like you're contributing to that wellness effort and that you're a very safe place for them.
yeah.
Well, thank you for doing what you do.
Thank you for having me here today.
As I was mentioning to you, Chris, I looked at all three questions, and for me personally, there was a common thread: human-to-human interaction.
Yeah.
So be it, what does the patient-physician mean to you? How do you create meaning in medicine and describe the future of medicine? It's all about patient who's a human and a physician on the other side, or another provider on the other side who's a human.
Yes.
Technology can come in, it may change the landscape, but eventually it's that interaction. It could be a patient-physician interaction. It could be an interaction between a physician and a learner. Could be a resident or a med student. But at both the ends, we have a human.
Yeah.
So the AI, the technology, it can modify that interaction. It can come into that space, but the principal players remain the same. And that's my perspective. I think the meaning of all of these three questions, it has to do with two humans interacting. And be it their verbal, non-verbal cues, how they come into play, I can't imagine technology ever replacing that.
Tell us your name and what institution.
My name is Anshu Singh. I'm program director at Cook County Hospital in Chicago. And as an aside, Cook County was the first hospital in USA where internship was started. When I say internship, I mean the first time in USA that residency experience was started. Cook County is also famous for being the first place in the entire world where a blood bank was started by Dr. Bernard Fantis.
Fascinating.
I feel
did
like
not-
Cook County Hospital has been in a couple of movies or TV shows too. I don't know if that's me just thinking.
Oh, yeah.
Cook County sounds familiar.
You know, in popular culture, people remember Cook County from the famous show ER or the movie Fugitive.
Thank you.
Fugitive right there.
These two were laughing at me, and I know my movies. I'm not a fugitive
Yet.
yet.
You got there.
That's right.
So with all the interaction that you just talked about within AI and the patient and the physicians, how are you helping the future generations of physicians process through the change that is brand new with all the AI and how to still keep really that patient at the forefront?
In my current role, I continue to provide care for patients, both in inpatient settings as well as outpatient settings. And there is no greater joy than knowing that one makes a difference to a given patient. And to see the appreciation from patients, it's phenomenal. And I guess that's what also creates meaning for me personally in my practice. Meaning for me also comes from my role as an educator, being part of residents' journey as they go through their training and then move on to their career, to their further career goals. And then as I look at the changing landscape and technology, my personal outlook is we should approach it with humility, accepting what is good, but at the same time, not losing sight, as I said earlier, that eventually the practice of medicine is about human interactions. And same is true for also medical education. On both the ends, you have a human, be it a patient and a physician or a teacher and a student.
What is your specialty that you're teaching on?
I specialize in internal medicine, and I perform both inpatient responsibilities as well as outpatient responsibilities, working alongside residents.
How long have you been doing this now?
I can answer that in multiple ways.
There's usually just like a single number.
Well, let me put it this way. I entered med school in 1992. I grew up in India, and that's where I did my med school. I actually did a residency in India, and I finished that before coming to US. So I did a second residency, so to speak, and finished that in 2007. So if you talk about my US experience, it's about 20 years since I arrived here to pursue my residency training. But overall, I started in 1992 as a medical student. So that would make it about 33 years now.
Where did you do the residency in 2007?
So I did my residency at Cook County Hospital.
Oh, wow.
So arrived at Cook County, and as they say, I never left. My roots have just been growing deeper and deeper in Cook County Hospital.
So 2007 to now is enough time to seeing the evolution of the trainees coming in and going out and seeing how the personalities and the exchange is what you're talking about with the patients. Have you seen a change of how new physicians in training behave and act and have a bedside manner than with some of the older physicians that you trained back in 2007, 2008?
Yes, there are changes in the sense that technology is playing a bigger and bigger role, and much of physician and provider interaction or time is drawn towards documentation and spending time in front of the computer. In terms of learners, I think there is a increased sense of what is in it for me. And there's a lot of debate, naturally, amongst educators. Is this a generational gap? And do we have to react differently to a newer generation? And I would say the answer is kind of gray. It's not black and white. The environment that each successive generation is exposed to and grows in keeps changing. It keeps evolving. So our external environment keeps changing, and our responses as humans are kind of a manifest of that. However, if we think about it, internally, human emotions, we haven't discovered and invented new emotions. So inside, we all have remained the same for thousands of years. So really, it's a question of acknowledging the external environment and how that's changing, not just for physicians in training, but for people in general, the next generation, but still being aware that internally we still respond to the same emotions, and possibly we can harness those emotions for positive motivations and move in a cohesive way towards whatever we are trying to achieve in our respective fields.
That's so deep. And, one of the things, we've done quite a few podcasts, and some of the physicians have talked about the pressure of seeing so many patients throughout a day, 20, 25, 30 or more, to be able to hit a number. Can you talk a little bit about how that's different or the same from 2007 or even going back to India to now?
In my viewpoint, in some ways, probably we are seeing less patients, but the burden of other activities seems to weigh in on our pressure, on our time, because time really is a currency for a physician, for that matter. And technology kind of made it harder, so to speak. But I also see the positive side, because it's almost like the pendulum always swings. It swings for good, then it swings for bad, and then comes back towards good. So as I look at the landscape of how AI is evolving, and from what I'm hearing, that AI can actually capture the gist of conversation and transcribe it for the provider into medical documentation. Yep. I think that's going to can be a game changer. It can swing the pendulum back in a positive direction for the patient-physician interaction. So I think that's a big game changer. As an educator, when I look at what individualized learning plans can be generated, how we can track the learning of individual learners, I think that again is a positive impact. So I think everything comes with its pros and cons.
Yeah.
And as long as we all can continuously come together, look at the evolving scenarios, come up with best practices, basically just working on things, we can all keep moving forwards. It may be 2 steps forward, 1 step back, but eventually we'll keep moving forward. And I would say the practice of medicine overall, in my years of practice, I've always felt that it's gone in a positive direction overall.
Well, I think if we have great leaders like yourself educating the future generations, I think we're going to be fine.
All I can say is I don't take credit. I am what I am for the mentors who contributed to my professional growth. I owe it to them. Many of them are my teachers and leaders at Cook County Health, as well as where I grew up initially. And of course, I have to also give credit to my parents because, we become who we become because of our parents and our teachers.
You know what I can appreciate about what you just said? A few minutes ago, you talked about humility, and then you just demonstrated it.
Yep.
I love that. A lot of people talk about certain things and then don't do it. You just did that.
I have no words now.
My name is Michelle Russo, and I work at the University of Rochester in the Department of Psychiatry. And my position is managing all of our residency and fellowships. And I'm going to give my opinion on how do you find or create the meaning in medicine. I think it starts with the bottom and working your way up. Working with every individual, any kind of position, even the cleaning staff, the facilities workers, everybody has something to say. Everybody contributes to everything. Really, with working with our residents and fellows, it's great getting their opinions, where they start, how they learn, and so we can create amazing doctors who truly care about patients and taking it one step at a time.
How long have you been doing this?
Medicine, probably the past 10 years in various positions, from payroll to events planning to social work and health home care, and then working my way up. I've been working in Suboxone clinics and now with residency and fellowship.
Right. So after 10 years, work jobs can become mundane sometimes.
Of course.
And monotonous, right? But this is an evolving field.
Absolutely.
So I'm curious, within the meaning of medicine, what gets you up and motivates you to continue to do what you do and show up and work hard for these people? Because we know you work hard.
It's the patients, it's the community, it's giving back, it's your peers. Everybody gets up in the morning, goes to work. Not everybody gets to enjoy what they do. I love what I do. I love where I work. Of course, there's stressful days, but getting to see the patients, hearing their stories, seeing them thrive, and then as a manager, getting all my employees and then starting with them just like residents. You get them their babies and watching them grow and expand.
We were just talking about all the different changes that are occurring through AI and the number of things that are going to continue to change. Where do you see your role evolving, and how are you preparing yourself to continue to evolve and support the incoming physicians?
I think every day keeping up on conferences and all of the learning modules and being a part of teams and groups. There's a few GME subcommittees that I'm a part of, and we are always discussing what's coming next, what's coming in the future, what can we do to continue ourselves and keep everybody moving and pushing along with us so we can be the best for our patients.
What's a hard day for you?
A hard day is, I would say, when you have a lot of little fires to put out and you don't have time to sit there and do like my typical day's work. But at the same time, those are also the best days because I get to see them come to me in little stressful moments. And I'm like, you know what? It's going to be okay. We're going to get through this. We're going to move on. And it makes them better. And it teaches them, okay, next time this happens, I know I can do it on my own.
And what are you hoping to get out of this conference this year?
To continue learning and further my networking. There is some amazing speakers here that truly just keep the ambition and the foresight to the future. It's just truly a remarkable conference, and I recommend anybody who can come here to send their workers here. It's unbelievable. Along with all of the vendors in this exhibit, it's just incredible.
Awesome. Thank you for sharing your voice, Michelle.
Thank you so much.
My name is Mamie. I'm from East Carolina University in Greenville, North Carolina. And the question described the future of medicine from my perspective. I see the future of medicine with great potential to continue to grow. Though there's been a lot of changes in our society in regards to funding and information, we still have physicians and learners that are eager to progress their field of specialty, and I don't think anything will ever hamper that, whether it be funding, whether it be lack of physicians, supportive networks. I think they will find a way to overcome those obstacles that will continue to give medicine a bright future. I've been in it for probably more than 10 years, but what I like about it is that you are instrumental in this whole process of medicine. You know, I don't have to be a physician in order to make an impact in medicine. My job is to make everybody else's job easier, cut down the time, the work for the administrative part, you know, because, hey, let's just face it, red tape is everywhere. And so my role is definitely something that I treasure and try and do my best in to make it easier for those that I do serve. Knowing ultimately that it is the patient that will benefit from my programs being healthy, satisfied, and compliant. The patient at the end of the rainbow is going to be the beneficiary.
This conversation was brought to you by Physicians Resource Services, a firm supporting medical professionals to improve their financial situation and pursue their personal and professional goals. The Patient Physician is produced in Austin, Texas. Editing and sound design are in the hands of the PodConnects Podcast Network. Please email questions or show ideas to info@physiciansrs.com.